Welcome everyone, and welcome to our first webinar on social prescribing on the fight to against COVID-19 across North East London. And thank you for everyone for your time in a very busy time for not only for the NHS but across the whole sector. So my name's Dr. Jagan John. I'm a GP by trade. I am a chair of Barking Dagenham CCG, and also lead for the STP on personalised care, and working on the COVID response as chair across North East London, across all sectors. We've got a fantastic mix of people in the room, and we have got a chat function. So if anyone wants to, say hi, they can. Please do, and of course we will use that as a portal with my colleagues and fellow panelists in terms of picking up questions. So the purpose of today is to find out how some of the social prescribing services across our STP North East London have been operating in the current climate of COVID. STP basically is the 7 boroughs that are working collaboratively together in the health and social care system. Some of the things that we'd like to do is get some tips of how we can overcome some of the challenges facing our social prescribing link workers. We're going to have some insight in the value of link workers. There's always an assumption that link workers don't have a great role at this point. Actually, we need them more than ever now across the system, and how we as a system and collaboratively can work together. There's also some time when we can think about, inspiration from each other and about the opportunities of us to collaborate and reach out to other services and systems within our system going forward. But just to be clear, across the system, we won't be able to get very detailed questions and queries that you may have, but we're happy to pick that offline. And of course, the list of all services that are available will be done remotely. And of course, we have lots of opportunities to get in touch offline through Leanna and Dan in regard to updates on guidance, training opportunities, and of course, operating models in support of tightening your own programs locally. Dan and Leanna are going to be having their BDIs on the chat function, and I'm going to leave it there. I would just like to take this point to say thank you to all the people that are doing really hard work and trying very hard to work with us for the benefit of our clients and patients going forward. Let me introduce Dan, and then Dan take over. Thank you.
Great, thank you, Jagan, and it's a real pleasure to be here with everyone today. And just to reiterate, we're so pleased to have so many people here, and really recognise that everybody's time is very, very valuable. So I'm Dan Hopewell. I'm from the Bromley By Bow Centre, and I'm one of the regional facilitators for London, a role which I share with Susie Griffiths from Healthy London Partnerships and Marcello Bertotti from University of East London, who are both here today as well. And also Leanna Martin, who I think probably most of you will have spoken to by now, who is the London Regional Learning Coordinator, whose specific function is to support social prescribing link workers across London. Just really to echo some of the points that Jagan's just made, really, today is very much around the value of social prescribing in the current context, and its value both to systems, local authority and health systems, and to the voluntary sector. Specifically, the role of social prescribing in primary care networks, and the role across boroughs as well, where there are whole borough schemes, and very, very specifically, of course, focusing on the function and role of social prescribing link workers. We know that the last couple of months, and more particularly the last month, has really changed the role and also the value of social prescribing to all of those. and everybody's getting to grips with a new operating model for social prescribing. So today is very much around exploring that. And I think it has to be said, there isn't one fixed model. Different boroughs are doing different things. There's an opportunity to learn across North East London from the different models. And it also depends not just around what social prescribing is doing, but to some extent what other parts of the system are also doing. We know in some boroughs, a lot of the work around working with shielded patients and those who are extremely vulnerable, for example, is being carried out by local authorities. In other cases, some of that work is actually being done by social prescribing link workers within primary care networks as well. So it's not about saying there's a right or wrong model. It's very much around exploring locally what works for the different boroughs, and within that the smaller geographies as well, and coming up with systems that work for you. We also know there's quite a lot of strain within the system as well. There's the huge numbers of people coming through now in terms of those identified as vulnerable, both for social needs and also for clinical needs. And of course, the services that social prescribing link workers have historically referred patients onto or clients onto have also changed radically as well. So there's a reassessment of what those services are, and that's something else that we'll be able to explore today. We've got 3 sets of speakers today, and we've got quite a tight time schedule, so we're going to give them 10 minutes each, and I'm going to be sort of keeping an eye on the clock on that. And then we open up to a slightly wider panel as well. So I'll be introducing each of those as we come through. And really to reiterate, today we will cover as much as we can, but we can take conversations offline, and Leanna and I are very, very keen to be able to pick up with people and support after today's webinar as well. But the first couple I'd like to introduce really are Miranda and Gulden, who come from Family Action in Hackney, both of whom have considerable experience. Gulden manages the service, the social prescribing service in Hackney. It's a whole borough service. It's gone from 4 link workers to 12 now, incorporating the 8 primary care link workers in one single service. And Miranda is one of the senior link workers there as well. So Miranda, I'd like you to invite you now to talk a little bit about how your role's changed and what's changed and what remains the same, and get an understanding of really some of the needs that are coming through that you're identifying with the people that you're working with, and also to understand how your primary care network is adapting, how things are working in terms of supporting patients, clients around COVID, and kind of what tips you might have to share with others. And then Gulden, after that, I'd like you to follow up a little bit more about how it's working more at a systems level. But let's start off with you, Miranda.
Oh, hi. Well, obviously everything's completely changed from when I started this role in January. And obviously we're encouraging people to stay indoors rather than enter the community. What my PCN in Wells Street Common has actually been really organised, and I've appreciated them making me feel like part of the surgery team. So what's happening there is that I've been given spreadsheets of patients who are in the vulnerable group, but also slightly under the extremely vulnerable, so people with dementia, COPD, mental health diagnosis, and I'm doing welfare calls for all those patients. And that is to really identify any urgent needs, of which mostly at the moment I would say it's difficulty getting shopping, difficulty understanding the government advice as well. So lots of people still continuing to go out. They don't really understand when they can go out and whether they can go to the shops. Some people who I have referred to social care whose carers aren't coming, or they seem more confused than normal. So some clinical needs, and others who have not bothered to get their medication because they don't want to bother the surgery, or they haven't called the surgery because they think it's closed. So it's really sort of public information service as well as referring on to other agencies. I think that as time goes on as well, there's going to be a lot of people feeling lonely. I've already come across quite a few people who need some telephone befriending support, and luckily that is available in Hackney, and I can refer on to that. Regarding the shopping, I've been using the Good Sam app, and also Good Gym for urgent support because their recruits are DBS checked. I think that what's helped me, my PCN have really helped me by including me in their communication. So I'm a member of all the WhatsApp doctors groups. We have a social prescribing WhatsApp group for our own team at Family Action, where we can share up-to-date information about, you know, current capacity of hot food delivery, for example. Also, we have very regular catch-up Zoom meetings, like 3 times a week, to share what's happening on the ground. One of my surgeries has links with a church, and they do also volunteers doing medicine runs and things like that. So that's really useful. And I just think, yeah, just having people in the surgery who, because I don't have remote access to EMIS, which has been a challenge, so it's nice to be able to contact people from the surgery. They can upload my notes from that day and also pass information on to the GPs. So actually, I found that it's working really well at the moment.
Great. Thank you very much, Miranda. That's really, really helpful to understand. And I think you've probably surfaced quite a number of the issues that we're hearing from link workers across many boroughs in North East London around some of those challenges, including that of remote access to EMIS as well. Gulden, could we bring you in now to talk a little bit about how it's working across the borough? And of course, one of the things to say about the Family Action Social Prescribing Scheme is that it's been in existence for many years now. So it's one of the mature schemes in North East London. And it would be interesting to understand sort of how you're working with services across the borough, how you're working with the voluntary sector across the borough, and sort of, you know, how are you replacing, I guess, or finding alternatives to some of the services that may not be running, or may be running in a very different form today?
Oh, hi everyone. Yes, it's been really challenging for the last few weeks for us. Just it sounds like, I mean, it seems like we are all setting everything up again. Social prescribing service has been running since 2014, so we have really good established working relationship with partners across Hackney, including Hackney Council, Hackney Volunteer Centre, Hackney CBS, and all the other small or big statutory or voluntary organizations. So currently what we've been doing, we've been attending all the key meetings in Hackney. So we share all the resources and getting all the updates from existing services, and we constantly updating our staff and our partner organizations about the changes of the service and wider community. Yeah, you can hear me, yeah? I can't, yeah, okay. So, for example, a good example to that, I am part of this MDT meetings now, which runs every week. So we go through the list of the very vulnerable patients, residents of Hackney, coming through the Hackney website. So we go and sort of triage those patients into appropriate services and make sure that they receive support around them. Yes, I think everything is just become now weekly meetings, so the work is quite intense, I would say. So it's keep changing every day. There is a new thing. What we've been also doing on the ground, just bringing all the existing third-party organizations and getting updates if there are new initiatives coming up, make sure that we are aware of those, especially around mutual aid or support services like Good Sam's Up. So we constantly get some feedbacks how things are. You know, we are trying every sort of new services first, and make sure that, you know, we are in tune with their you know, with their services, and they are doing a good job at the moment, really good job.
Great, thank you, Gulden. That's really helpful. Can just be great to get just a little bit of an addition. How's it working with primary care? You said that you're working in the you're attending the MDT meetings now. Is that across the? Is that you and the link workers across the whole borough?
It is managed by the partners at the Hackney Council. So it is not primary care MDT meetings now. It is across a whole system. At primary care service, we are, because social prescribing, our service has been based in primary care settings. We still keep our existing appointment slots. So GPs are free to book patients when they come across with any social, you know, with patients who need perhaps needs in response to COVID-19. So we still keep our slots for GPs, but on top of that, what we are doing, we are asking all the GPs and GP practices to actually provide us some list of vulnerable people, so we could just make some welfare calls to them to make sure that whether, you know, they are shielding, if they are not shielding, you know, just to sort of provide some guidance around what it means. Also, if we are asking if they have any family, friends, neighbors support around them. So it's really sort of, you know, at the moment we've got two roles. We still continue with the primary care service. On top of that, you know, we get those lists of vulnerable people, so we can do some welfare checks. You know, of course, you know, out of those checks, you know, we see that many people are quite worried. They are feeling quite isolated, wanting to chat. You know, they need some sort of perhaps counseling, or they have mental health issues. Some families perhaps, you know, asking some entertainment or how to educate their kids, for example. Some of them, I mean, again, another big sort of issue that we get, they are running out of money and food. And there is also considerable rise in homelessness as well. So yes, the demand is high right now. Perhaps it is going to be even higher in coming weeks, especially around domestic violence, domestic abuse, also bereavement, mental health. I think, yes, we are going to ahead, you know, we are going to be having more challenging time ahead.
Great, thank you very much. I mean, that's a really broad and comprehensive understanding of how you're working. Just before I leave you both, Miranda and Gulden, a couple of questions have come in. One for you, Miranda, around how do you send the notes back to the general practice? Because I presume you're working from home, and it's great, obviously, that you're able to do that. But just a question about how do you send them, and how do you make sure that's secure? And one for you, Gulden, which is about the NHS responders, and a question if they're all DBS checked or not, in terms of them coming to people's homes and dropping off medicine, for example.
Shall I go first? So yes, it is obviously very tricky to make sure that the information is secure. So when I get sent the list of patients, I don't save it anywhere on my computer because it's a private computer. I do have an NHS email, which I had to ask to be set up by one of my practice managers, but I do have that now. So it's a question of working on the document and sending it back, and making sure that I don't keep any information on my own computer. That's what I've been doing so far.
Great, thank you. That's really helpful. And around the NHS first responders, Gulden, do you know if they're DBS checked in terms of them going to people's homes and dropping things off and so on?
I believe yes, they are. They are DBS checked, and people. I mean, I don't know the procedure at the moment how they are recruiting it, but because they are registering on NHS website, I would say that there is a system in place already checking people DBS, or I don't think they would be putting any vulnerable individuals under any risk.
Right. Are you also working with the local mutual aid groups as well?
Yes, we have been in contact. I mean, we of course mainly work with the Hackney Volunteer Centre, because we know that all their volunteers are DBS checked and all the safer recruitment are in place, and they are working with extremely vulnerable people in Hackney for food and medication delivery. So that would be our first sort of choice when we come across with very vulnerable, extremely vulnerable people. However, there are some people that perhaps do not meet those threshold. They might just need to, for example, self-isolate for some reasons, and they need maybe shorter support. And then really, we sort of open up conversations with them whether they are comfortable to be using any mutual aids and provide the information. But apart from that, we have been liaising, talking to those, one of the leads in Hackney in some of the mutual aids, and I understand some of them are quite organized, very well organized indeed, and they have some system in place to check people. I mean, I understand they are usually from that individual ward or from they are the community leads anyway. So I understand that the volunteers are, most of them are from that particular ward, and if people feel comfortable and using the mutual aids, I don't see why not, because they are also doing a good job. And this is about receiving and giving support. For example, some of them are offering dog walking, which is really, really incredible thing to do for some of the residents that we have, because they don't have anyone else and they have to be inside for, let's say, 2 weeks. So yeah, does that answer your question?
Yeah, that's really, really helpful. Thank you. I'm now going to come on to you, Roberto. You are one of the GPs at Bromley By Bow, and it'd be really great to hear your perspective on social prescribing and its function in this particular, incredibly unusual circumstance, really. I know you're a great advocate for social prescribing generally, but it'd be really great to hear, are you socially prescribing at the moment? How's that going? And to really get kind of the clinician's perspective on the value of social prescribing, both, I guess, traditional social prescribing as we've known it before, but also in the current context as well, and how that's adapting.
Roberto, you're on mute, I'm afraid. Roberto?
Hello, is that any better?
Yeah, that's it.
Oh, fantastic. Sorry about that. Yeah, I'm a GP in Tower. Roberto. Yeah, sorry about that. I'm a GP in Tower Hamlets at Bromley By Bow Centre, and general practice has been under enormous strain really in the last since the outbreak, and we've really transformed the way we're talking with patients and communicating with patients. So we no longer do face-to-face consultations. It's mostly done over the telephone or video. And it's really put us in a very unusual circumstance, and therefore our referrals into social prescribing in an unusual circumstance. So the reality of referring is very similar in its methodology. So we would use our forms which are embedded within EMIS. However, the need seems to be rising at a really dramatic rate. there seems to be a lot of social isolation, health anxiety, concern about both their health and their sort of psychosocial elements of their life. Lots of patients are obviously have either been furloughed or on 0-hour contracts, have had their contracts terminated. So there's quite a lot of anxiety about their finances and how the surgery is supporting them through this, given that we're not doing a lot of face-to-face consultations, which patients can be most used to. I think the points mentioned earlier too about the safeguarding is particularly important, and the vulnerability of patients. And lots of GPs are very vigilant to this, as we know that domestic violence and domestic abuse will be rising. I think it's really important that we continue to make referrals into social prescribing, but also support our link workers who are probably working from home in the majority of cases, and making ourselves available to them and sharing guidance as it comes out from NHS England and NHS Improvement, because the guidance is changing rapidly and it can be quite difficult as professionals to get our head around. And I think it's really important to think about terminologies that we're using. So some patients are at extremely high risk, and some patients, and therefore need to shield and have 12 months 12 weeks rather in complete isolation away from their family members, as well as some patients who are at high risk and just need to do stringent social distancing. So I think it's just really important to think about our language and make sure we're using the same language. I think that otherwise social prescribing is of great value during this time, and I think we really need to encourage healthcare professionals and patients to self-refer. I find often that our receptionists often know the vulnerable patients just because they're the ones that often come in, and they can often spot them a mile off before GPs. So I think encouraging the entire general practice team and primary care team to really think about our vulnerable patients during this obviously very difficult time.
Thank you, Roberto. That's really, really helpful. And we might come back to you a little bit later, but that's really, really, really good. Darren, I'd like to bring you in now. So you're one of the veterans of social prescribing, and along with actually with Gulden as well, you know, one of these very established schemes in Northeast London. One of the interesting features about your scheme historically being that it was telephone based, and it would be really and that was very unusual, and we all used to remark on that unusual characteristic about it in the world of social prescribing. Of course, now it's actually come to its own. So it would be really interesting if you could share some of the experience that you've built up over the last few years, really, around working in social prescribing via the telephone. But another interesting feature about your scheme, I know, is that it was cited, I think, within the local authority. It had very, very strong links with social care as well, which was also an interesting characteristic, and again, not all that common within the world of social prescribing. And of course, we're now seeing patients with a whole range of vulnerabilities, not just health vulnerabilities, but also vulnerabilities around their wider care needs as well. So it'd be really great to hear some of that experience as well from you. And I guess how you're shaping that now in the context of COVID-19.
Great, thank you. Can you hear me? Yes, just give me a thumbs up. Great. Good to be part of this. And I deliberately came in where I am with my colleagues in adult social care. My manager is just 2 rows behind me, so I'll be very careful what I say and make sure that I show the support that we're trying to also provide for adult social care. But I'll come back onto that in a minute. First of all, just to say, for us, as you rightly mentioned, Dan, we started in 2016 and funded through the Better Care Together Fund and also Public Health, and based in adult social care. So we have the benefit of having the 3 links, if you like, very much looking at the integrated health and social care environment. I think for us also, we were a telephone service, probably one of the few telephone-only social prescribing services in the country. And so for us, it felt like business as usual when all this happened, and we keep getting requests from people about doing telephone service, not just calling somebody, but what is an engaged conversation, what's a guided conversation. We have been used to talking with people without any body language at all, because we're using picking up the cues from the telephone. So it's been quite useful that for us we have had that experience. We also in a difficult situation where our social prescribers, we have 9 that started on, forgive the day, it was April Fool's Day, but they started on the 1st of April, and they are 9 because although we have 7 PCNs, we have a job share and part-time workers as well. So our 9 started, some of them are listening to this now, and they realize that some of the issues that they have, not, I mean, your established ones in Tower Hamlets and Hackney and other places, they don't have mobile phones yet, or laptops, or even ID badges. All of that is being processed now. So they've started with having very little. So that's been a mountain to climb for us in terms of getting them sorted. But I think one of the issues that has been really helpful is that we have had a very good, developed over 4 years since our service has been set up, with the GP practices, with the primary care. We have a very good relationship with the clinical directors, and I think, Dan, you were asking an earlier question to our colleagues from Hackney. So for us, how we have developed that further is we have, I'm not going to name him, but we have a GP that we call our champion social prescriber GP. He is a GP who over the last 2 years has been our top referrer. He absolutely buys into social prescribing, and he's a huge support. So I invited him to attend our social prescribing national day on the 12th of March, the event that we held, and he spoke to the people there. And we had a number of voluntary sector, other health and social care partners. And I think it's really important if you get a really good champion, and he is a clinical director for one of our PCNs. So he was one of the first places that his social prescriber met, and he is looking at those lists that other people have talked about, so we can look at the welfare calls that we're doing. Our social prescribers are set up as a WhatsApp group, and the first thing I gave them to do, because they didn't have work mobiles and laptops, is I asked them to do research into the local area, which they have done. A lot of them have become very familiar with the mutual aid groups that cover nearly all of our 20 wards. They've introduced themselves, they've found out what's happening at a local level and how they can link people. I do say that there are 2 words that we're not using. We're not using the 2 R's. We are not recommending and we're not referring, because although these groups are doing some wonderful job, we don't know who they are. So what we are saying is to people who we speak to, there is a local group in your area. This is the phone number. We have spoken to some of them. And so that's the way we are giving out that information. Our group is also our new social prescribers. We set them up straight away on the Microsoft Office team. And so we've done a couple of e-learning training with them already. So I'm really impressed that they've all taken to that quickly. And we meet weekly, and we're sharing, and what I've encouraged them to do in the gathering the community intelligence, like Good Gym and what Good Gym is now offering in Waltham Forest. They share that amongst themselves. So it's a good camaraderie, good spirit. And we're going to be doing some training tomorrow on the guided conversation, because as I say, our new social prescribers, some of them have not had the benefit of that induction program that they would have had if we had started under different circumstances. We are also looking at something called linking, because we work with, as Dan, you were talking, the Managed Network of Care and Support is an umbrella network that we are linked in. It has our other teams like Wellbeing at Home and Local Area Coordination. We discuss weekly, we share that information across all the partners. And one of the things we've been discussing just this week is the having volunteers linked to the link workers. So I have already been discussing with many of our patient participation groups, and health champions were very keen to meet our new social prescribers, but obviously they can't meet them face to face. So we're now going to link in with them about whether any of them would like to be linked with a social prescriber to do some of the welfare chats. So that would be a good way to involve your PPG and your health champions that many of you probably already have. So, you know, they're very keen. And I think the other thing is our council have set up what's called the Waltham Forest Community Support Network. That's about 3,000 local volunteers. And what we're trying to do is link in with them to see what they're offering locally as well. Going on to social prescribing and the adult social care, I think that's my team, my small team that's based in adult social care. We have done we've done hospital discharge training so that we can try and help support the adult social care team that are providing that support for people who are being discharged from hospital. So that's the other way that we are working. So quite a range of things that we're doing, but just remember with caution, our new social prescribers only started on the 1st and they hadn't had the benefit of actually meeting many people.
Great, thank you very much for that, Sharon. That's really, really interesting to hear all of the developments that you've got and some of the structures that you're putting in place in Waltham Forest or working within Waltham Forest as well, and the wider offer that you have around the managed network of wellbeing and support as well. So it's really, really interesting, and the idea of using volunteers and this whole group of, as you say, of 3,000 volunteers that you're starting to approach and tap into, as well as the idea, of course, of hospital discharge, which will be, I guess, an increasing issue as this crisis unfolds, really.
Yes. And probably just to say two things that I forgot. One thing that you'll remember when I used to work in Tower Hamlets, we used to talk about with the GPs the heart sync patients, which we now call the frequent attenders. And again, this morning I was speaking to one of the clinical directors that they do have a list. Because one of the worrying thing is, if you remember, those of you familiar with the frequent attenders, they often sit in the surgery maybe on a Monday morning or whatever. Now, what's happened to them? Because that was a bit of a lifeline for them. Might make the GP's heart sink, but it was a life. Now, we are worried about what's happened with those people. So what I said to the clinical directors is, if you have a list, and you might know through your practice staff, give us that list and we'll make phone calls to them. So that's looking at the frequent attenders as well.
Great, thank you very much indeed. Thank you. We're now going to I'd like to encourage people, if people have got questions, if they could put them on through the chat function now. We've got a panel waiting in the wings, time permitting, I hope to be able to bring all of you into this now, but we're very, very keen to be able to respond. We've got a further panel of more experts, really, and it would be great to, if you've got particular questions that you'd like to pose, we'd be really keen to be able to field those questions as well. But I'm going to just lead off now with one. I'd like to bring you in, Mohan, if I can. Mohan, another great advocate for social prescribing in the world of primary care in southwest London. And one of the things that I'm curious about is that the guidance that came out, I think it was last week, was suggesting that primary care networks might now move to recruit additional link workers. And there was talk even potentially of moving up to 4 link workers per primary care network, in part as a response to the current situation. But of course, these are no ideal conditions in which to be making those recruitments, and time, I'm sure, is very precious. But I'd just be interested in your thoughts about how social prescribing might scale up now and what some of the options might be, including working with the voluntary sector around that.
Yeah, can you hear me? Didn't get a sound check before, but yeah, and I'm not Leanna Martin, just for those of you who think I'm Mohan Seekran, but thank you for asking me to come. So yeah, I think social prescribing, yes, before we looked at patients who had preventative root line cause problems, and we were kind of helping to target them, but now we've moved to a crisis, and not only are we looking at this cohort, we're now looking at the patients who have now become vulnerable as a result of the crisis. So patients who've lost their job, patients who are lonely, who have now become so not only we're getting a much bigger amount of people who we're having to resolve. Mental health is becoming a big issue, and certainly we're training up all our link workers to get some support in that, depending on what their baseline is. We're going for the next level, so that's part of the work they're doing at home. So in terms of, I would welcome more link workers to sort of help support not only their welfare stuff, but also the mental health support, and also some of the other things which have been coming out of the crisis. I suppose the only tricky thing is how do we recruit them, as because of social distancing we're not kind of all meeting up and we can't have that official role. So a way around that may be to second volunteers or link workers or navigators from other voluntary sectors who may be not working as a result of the pressures we've got. That may be one way around it. Another way is volunteer some of the mutual aid guys who are able to help, and again you need to DBS check them. I know the SAM's resource is massive as well, the volunteers from that who NHS checks. So I think there's resources there available, and I think there's a massive need, and I think what I'm hearing from other networks and other GPs is that they don't know how to deploy them, which is sinful. And I think it's if we can meet them or link them to where the demand is, it's been hugely successful. So I think there definitely is a demand. Where we can find them, I think from what your existing services are, if you can get a recruitment process, then great, but that might be slightly tricky.
Great, thank you very much indeed. Thank you. I'd like to bring in Isabella now from Newham. It'd be really interesting to hear, because you're working on the ground with the social prescribing program in Newham. What you feel some of the elements of the offer might be now, and how are you having to rethink kind of the services that people are able to access or needing to access now, and if you've got any thoughts about how you can do that in these kind of very, very constrained circumstances where services can't work with people face to face anymore. Are you there, Isabella?
And unfortunately, Isabella's not logged in.
Oh, okay. Well, can we come back to you on that, Mohan? And what's the feedback coming back to you from link workers about the services that they need to be accessing, and how they can really, how they can find those services, and are there gaps appearing, for example, within, the link workers say that they need services that aren't available anymore, that sort of thing.
Yeah, so we're quite fortunate in Merton where we've got a voluntary hub, and what that comprises of the social team and also the Merton Voluntary Service Council, and they're physically together in a building, not too close obviously, but they're together, and they have about 5 or 6 workers there, and they've been coordinating the volunteers, they've been coordinating social packages from the shielded list, they've also been coordinating any other supports which patients may need from dropping prescriptions. So the link workers have been feeding into that and finding out what services are still existing, which ones are still standing, which lunch clubs are open or closed, but which services do exist. So that's a nice central port. The mutual aid work was kind of slightly separate and slightly not aligned, but now they've been brought into the fold, and we're looking at hopefully an exciting model to see how we can use mutual aid to support medical patients, which I'll let you know once we get it up and running. But yeah, I think having a central point or coordination point is really, really important, because I think what you don't want to do is then disalign what's really happening, and you need to be kept up to date about what services exist. So they're continually up to date, and they've got WhatsApp messages, emails, and they've been communicating with each other and their practice leads.
Great, thank you. Marcello, are you there still? I was just wondering, we've been having some, I'm sorry, this isn't a pre-prepared question, so I'm not trying to put you on the spot, but any thoughts about how we might record and evaluate what's going on now? The numbers are huge, everybody's incredibly busy, and obviously we don't want to dedicate huge amounts of resource to kind of paperwork and so on, but it is a very interesting opportunity to understand what's happening and the value, if you like, of social prescribing in this current context. And I just wondered if you had any thoughts about what you think people should be recording or would be helpful to record, and what they might be understanding in terms of the outcomes of the service. And that might not necessarily be quantitative, it might be qualitative, I don't know, but I'd be really interested to hear from you about what you think the opportunities might be at the moment.
Well, obviously, as you said, I mean, clearly priority needs to be given to supporting people, and collecting data might be not such a high priority at the moment. But I guess it is important to understand more about what is the impact of link workers in these particular conditions. For the future, really, because we might also have pandemics in the future. So this could be used as to prepare ourselves for a future, and perhaps be more ready in the future, if you like. I mean, that's one of the benefits of evaluating. I guess the most important part, I guess, is the mental health part. A lot of people, I mean, from all the presenters today, but also from other sources, it's quite clear that there is a big mental health aspect to this. The social isolation, people who are socially isolated, frequent attenders, and so on. So I think the mental health of all these people is probably the most important part that could be collected, could be assessed, you know, through an evaluation. And also the access to services. I mean, obviously most people have problems, especially those who are most vulnerable and need to stay at home. They have problems with accessing food and medicines primarily. So it would be good to know how much they can actually use the services, and the volunteers, the huge number of volunteers now. And how can they access those services really? How can they benefit from those volunteers and the food and the medicines, whether they get this medicine, the food? The access to services and mental health, really, for me, probably the most important. In terms of how to do it, well, it's tricky, because one could think of SurveyMonkey, for example, for questionnaires, assuming that most people have some sort of internet connection and have a smartphone. Now SurveyMonkey can be used through a smartphone and so on. So for more survey-based work, for qualitative, but one could think also, as you alluded to, Dan, could think about qualitative interviews, more qualitative work. We are experiencing, well, not experiencing, we are kind of trying with different video conferencing tools, including this one that we've been using now. There are some issues with the ethics and the GDPR that needs to be looked at, particularly around recording interviews and so on. I mean, maybe I'm going into too much detail here, but yeah, I mean, the qualitative could be quite useful if it's targeted to specific groups, and that's it really. I mean, happy to answer any questions.
Great, thank you, Marcello. Yeah, that's really helpful. Liana, could I bring you in now? You've been talking to maybe upwards of 100 link workers in northeast and southeast London in the last couple of months, or shorter than the last couple of months. Any sort of overall insights from you about what link workers are saying their needs are at the moment in terms of support and development for link workers and training? I know Sharon just mentioned some of the training that she's been doing as well, but it'd be really interesting to hear from you what you've heard from link workers as you've been talking to them in the last few weeks.
So it's interesting that Marcello mentioned surveys. We've been surveying link workers across London, and it feels like a big part of what they are needing right now is some camaraderie. So there's a lot of, I mean, obviously all link workers, you know, no two models are the same, and everybody's sort of taking a slightly different approach, especially in this COVID era. There are some that are carrying on business as usual with their new normal clients, some that are going through the shielding list and making very, very quick triage calls, others that are speaking to the same people every day, those that they've identified as the most vulnerable, they're working with them. But I feel like there's a lot of link workers out there who are, by the end of the day, exhausted. They've been talking to a lot of people in very difficult situations, and they need a safe place to offload and a safe place to sort of breathe out at the end of the day, so that they're not carrying all of the frantic sort of chaos that they've been absorbing all day. I think in terms of support from the organisations that they're working with, it's a place to have that. It's space to lift their head up a little bit and see what services are available, and that have gone online, ways in which they might be able to be supporting their clients in this new era of everybody staying at home. I think in terms of practical training, it seems really clear that support in taking things to the telephone, whilst people are pretty comfortable with, we've got an army of people with fantastic empathy skills and the ability to build rapport. But I think on the crucial issue of suicide prevention and supporting soft skills around supporting mental health over the phone is definitely something that both myself and I know several organisations in East London are looking at. Newham have been working with City and Hackney Mind to take their mental health first aid online, which I'm hoping we can open up to all link workers. We're looking at motivational interviewing. There are some the GP Federation in South East London who are looking at doing an online module in motivational interviewing. We at the Bromley By Bow Centre are looking at all of this training as well. And I think obviously in some cases where people are supporting groups of individuals, there's an opportunity where the voluntary sector has been, hugely affected, for some link workers to be setting up. I've heard of some people doing some fantastic things, setting up some online groups, using a variety of different platforms. And actually, one thing I should mention, going back to the support, the sort of more emotional support, we've secured some pro bono therapist hours to pilot a kind of like a group offload session, and we'll be doing a couple of hours a week. So if there are any link workers out there that are interested in signing up to that, then please do drop me a line outside of this. Is that helpful? Is there anything else?
Great, thank you, Liana. That's really, really, really helpful. We've just got a couple of minutes left now, and trying to draw this to a close. Susie and Najnin, I haven't brought you in yet. Any last thoughts from either of you two in literally a minute each or thereabouts?
I'm really sorry. Could I just put this question to Najnin perhaps? Question from Joe Cumber. I wondered if all patients needed consent on referrals for social prescribing, or whether the GP can assess need.
Najnin, are you there?
Yeah, I'm here. Sorry, but I couldn't hear Leanna's question. Sorry.
It's about whether or not patients need consent to give consent to be referred over to social prescribing. Or can right.
I think it would depend on what the social prescribing link worker is employed by. So if they're subcontracted by a voluntary sector, then yes, they would need consent. But if they're just employed by the PCN, then no consent is needed. As far as I'm aware, that's correct.
Great, thank you, Najnin. Just coming back to you, Susie. Any thoughts, because you're working pan London, of course. Be interesting if you any thoughts on what we've been discussing today, just as part of rounding off.
Yeah, just to kind of really just thank everyone for coming today. And obviously this is the first online webinar that we've done in London, and it would be great if we can do similar with the other STPs. And so it's really great to hear all the good work that's going on the ground, and we're really trying to capture all the good practice case studies, trying to get an idea of what's going on so that we can feed that up to NHS England, who are sort of really doing a good job in sort of coordinating the link workers nationally. So I'd just like to urge people to use the Future Collaboration platform on the NHSE site. Get in touch with us on Twitter, email. We're here to sort of help and support, and yeah, just want to say thank you, everyone, and keep calm and carry on.
Great, thank you, Susie. And so yes, just to reiterate that, please do get in touch with Susie or myself for further support. Okay, Jagan, I'm going to hand back over to you now, but just before I do, one question that came through from somebody was sort of about systems, really, and I think echoes some of the things people said about people losing their jobs. Universal credit takes weeks to come through. Those who are self-employed won't get any support for a month or two from now. Food banks, and I'm a trustee of a food bank in Tower Hamlets. We are running out of food. Interestingly, we're not running out of money at the moment, but we're finding it very hard to source food. So there's kind of a whole approach that needs to be thought about to support people in communities, and something that I think Susie and myself would be very interested in working across STPs in London to support the thinking around some of that and how we bring that together. But we'd be interested to hear from people who would like to, who might need help or support on that, and we'd be really happy to work with them. But Jagan, can I hand over to you now to wrap us up, and it'd be really great to hear final reflections from you.
Thanks, thank you, Dan, and thank you for all the contributors today. It was very good. Apologies, you can't see me, my cam's not working very well, so just have to listen to me if that's okay. So what we've heard is actually a really good array of different things. I think for me, the biggest thing that we need to reflect on is the fact that we are all in different places, and we all have very different ways of methodologies of how we're working with our patients, and there's no set rule. And I think we have to all remember that actually there is no, it's whatever works for you within the resources that you have. But what we can do is learn from each other about what do we do next. I think in the context of COVID-19 and obviously this very difficult time, and the fact that we've got this artificial group of patients who've now become housebound patients, we've suddenly got an increased need within the system, and general practice and all our services are now dealing with not only just the sick with COVID symptoms, but also people who've been asked to remain at home. So that brings a completely different system pressure that we've never had before. The other problem I want to mention is that we're going to have issues, and I know some of the questions are, we are going to have low-level mental health as people become very anxious about the whole system. And, obviously I've heard patients come to me, they're even hearing about Boris Johnson being in hospital has caused a huge amount of anxiety within those groups. So our social link workers are also going to be very much in touch with a lot of, what's happening on the ground, the raw nerve of the community. I think one thing we do have to remember is that a lot of the things that have been mentioned today, you have to take it with a pinch of salt. It's not set in stone. There are things that you need to work with your other colleagues and other link workers and your teams to work up. And of course, Dan and Liana are here to also really help you if there are any particular issues that you're struggling with. I know there were some questions about young people, and some boroughs are doing working well with their children's services, as well as also the children provision, because child poverty is also a big risk within this era. And that kind of reflects on the food banks issue that Dan was talking about going forward. And I think the other thing is that one thing we must also remember is, as link workers, you are professionals and you will have your own needs, and we mustn't forget that you will need support. And it's really important that we support each other during this time, because many patients and residents, unfortunately, are not engaging with the hospital, and they are decompensating, i.e. they're getting sicker at home. And it's sometimes the link workers that pick up on the fact that these patients are acutely sick, which can be quite distressing. So we do need to think about, you know, how we can make sure that there are systems, and you have a good system of reporting where you feel that things have, you know, things are going downhill for these particular families or residents or patients. And I think, you know, one thing is just, all I can say is thank you very much. This is the first of many webinars that Dan and Liana are present. I think they're very useful, and I thank all the contributors for all their really good advice. I think we need to push, I think, a few more to support each other. What I would ask before we sign off is, please complete the feedback form. And if there are any particular questions that I or the team or in terms of the regional coordinators can help with, we're very happy to support that. And of course, any of the panelists, I'm sure they'll be very willing to help with any particular questions of things of how they've done things. All I can say is, well, stay safe, make sure you look after yourself, and remember, all I can say is that we are all in this together, and whatever we can do will help people. And once this is obviously, as you know, was mentioned before, I think there'll be a lot of reflection of how we deal with pandemics in general over the next couple of months, if not years. And that's it really from me as signing off. Dan, is there anything else you'd like to add to that?
No, I think that's fabulous. Thank you, Jake. And yeah, just please do, everybody, if you can complete the feedback form. We do want to do more of these webinars. We'd love to hear from you about what frequency you might want them, topics for further webinars, and absolutely to echo, we're here to support, and please do get in touch if we can be of any help, and very much around sharing ideas and sharing, and Susie and Liana and myself pick up a wide range of ideas from across London. So we've got a lot of ideas that we can share with the colleagues in North East London as well, from across London. And it's been fantastic to have you all on here today, and I look forward to being in touch with you in the next webinar, but between now and then as well. So thank you all very much for your time today. Yep.